The aim of the renin-angiotensin-aldosterone system, or RAS, is to maintain blood pressure homeostasis. The juxtaglomerular apparatus is composed of the macular denser cells, which monitor sodium chloride concentration, and granular cells in the afferent arterioles. Decreased delivery of sodium chloride is registered by the macular denser cells in the distal convoluted tubule. This triggers the release of paracrine signals to the granular cells, resulting in the secretion of renin. Additionally, decreased blood pressure is detected by the pressure-sensitive granular cells, which releases renin and initiates RACE. Angiotensinogen is an inactive hormone in circulation which is produced predominantly by the liver. Once renin is released, the hormone cleaves angiotensinogen, which creates angiotensin 1. Angiotensin converting enzyme, or ACE, is localized to the endothelial cells, particularly in the kidney and lungs. Upon interaction, ACE cleaves angiotensin 1, which creates the active peptide angiotensin 2. The peptide then attaches to G protein-coupled receptors, which stimulates a thirst response, vasoconstricts arterioles, and triggers the secretion of antidiuretic hormone, or ADH, and aldosterone. Aldosterone is secreted from the adrenal cortex and acts on principal cells in the distal convoluted tubule and collecting duct. Aldosterone increases the expression of sodium channels and pumps which accelerate sodium reabsorption. Antidiuretic hormone, or ADH, is a hormone released from the posterior pituitary gland, which also binds to the principal cells in the distal convoluted tubule and collecting duct. ADH increases the expression of aquaporin, which facilitates the movement of water from the filtrate to the peritubular capillaries. The reabsorption of sodium alters the concentration gradient, which increases water reabsorption via osmosis through the aquaporin. Elevated sodium reabsorption and increased expression of aquaporin aids in the rapid reabsorption of water. This increases blood volume, which increases blood pressure. Angiotensin 2 stimulates the thirst response in the brain, which promotes fluid intake. Increased water intake reduces blood osmolarity and increases blood volume. An increase in blood volume consequently increases blood pressure. Likewise, vasoconstriction of arterioles increases peripheral resistance, which also increases blood pressure. The maintenance of blood pressure is fundamental for health. Prolonged hypotension can have significant consequences, such as decreased cognitive ability. More precisely, a person's capability to utilize attention and memory diminishes due to decreased cerebral blood flow. Severe hypotension causes the body to malfunction as adequate waste disposal is stopped due to the lack of blood flow and oxygen delivery around the body. This then leads to shock and severe organ damage. On the other hand, hypertension can also cause significant damage to the body, especially if left untreated for a prolonged period. When the body is experiencing high blood pressure, it can unknowingly cause significant damage to the kidneys, blood vessels, heart, and brain. Damage to vital organs ordinarily occurs before any symptoms are present. More specifically, hypertension is one of the leading factors causing premature heart disease and strokes in patients. In the heart, hypertension damages muscles and causes fibrosis due to an increased afterload. This enlarges the left ventricle and weakens its structure. Hypertension may also lead to ruptured arteries in the brain, causing a stroke. Additionally, hypertension may also cause thickening in renal arterioles, which reduces blood supply. Although RAS is responsible for regulating blood volume and flow, it can also be triggered when it is in fact not needed by various diseases leading to hypertension. This is known as an overactive RAS, and normally this defect in the body can be neutralized by using RAS inhibitors.